you think is the biggest misconception about psychiatrists and psychiatry?
Yeah, I think the biggest misconception is that we just medicate everything, that we're there just to write prescriptions. And really, when you look at our training, we go through 4 years of medical school like any other physician. And then we have 4 years of psychiatry training. The first year is really internal medicine and neurology. So we're in the hospitals taking care of people in medical units and neurological units. And then we have 3 years of 60 to 80 hours a week of taking care of people with both aspects of treating them with medications, but also psychotherapy. So we're trained in core psychotherapies, psychodynamic psychotherapy is one of them, as well as cognitive behavioral therapy. And we have significant supervision and education. And so we're really utilized because there are not a lot of us. We're really utilized in a general way as prescribing medications. But really, I think what most of us enjoy doing is a mixture of doing psychotherapy, prescribing medications, and just treating the whole person.
Well, that's what I see in my practice too, is the balance. Because I'm all about the medication. I can counsel people on taking what time to take it and side effects and all that. But they need so much more than just the medicine, because the medicine is either just going to mask or it's going to help them, but they absolutely have to have that same, one-on-one relationship. How do you balance of time? How many patients can you see in a day? Because you can't. It's not a. I go to my GP and I'm in and out in 6 minutes, what's a typical?
Yeah, it depends on where you are, and I think corporate medicine is kind of something that I really try to rally against. But where I work at Hopeway, we see people for an hour and a half on our first session, and at a minimum of 30 minutes every week after that. And so I always tell people it takes you about probably 10 to 12 minutes to actually talk with someone about a medication and are you having side effects and how is it working. I use the other time to ask them about what's going on with you.
And I want to talk about Hopeway, but before we do, I want to run back to what you said too about the way that you all collaborate medically. I think, if I'm not wrong, compliance and worrying about side effects, especially with psychiatric medicine, seem to be the thing I hear all the time. They get the pill, they take the pill, they say it doesn't work. I feel tired. I mean, how do you all deal with that from a psychiatrist's point of view and then from a pharmacist's point of view?
So just real quick, it's not even just worrying about the side effects. It's real. A ton of them are loaded with side effects. So it's not that it's uncommon at all. It's very common. So the good news is most of those side effects go away over time. You can manage the side effects, tweaking doses, that kind of thing. But
so what I hear you say is it's educating. Is that part of what you do when you're talking to folks about medicine?
Absolutely. Yeah. If you kind of let them know what's going to happen, or what's possible, then they're not surprised when it happens. And then if you have a realistic discussion of this is how it's going to help you, this is what you might expect as a side effect. It's up to you to weigh whether or not the benefits are outweighing the side effects. And one of the biggest problems I have is people won't come and tell you. They'll just stop it. And I'll tell them like, hey, if you just told me, we could adjust it. We could switch to a different agent. We have plenty of things that we can try. But a lot of times they just sort of reluctantly stop it. Or they stop it because they're feeling better.
I was right. No, is that true? Talk about that. Tell us more about that.
Yeah, I mean, a lot of our illnesses are just recurrent illnesses. So, you might have this predisposition to have a depressive episode or to be anxious. And during these episodes, you might have a medication that really helps you along with therapy and other lifestyle stuff come out of it. But you're going to be at risk of having another one. And sometimes there are illnesses that, like bipolar disorder, that really require medications to be taken consistently throughout one's life, quite frankly. And there's a lot of medical conditions like that too. So sometimes people feel like, well, I'm better, so I don't need the medication. And they kind of lose sight of the fact that maybe one of the reasons that they are better is because of the medication.
Oh, and absolutely. It's not just psychiatry. It's, my blood pressure's fine. I don't need that medicine anymore. My diabetes went away because I'm taking the medicine. I don't need that anymore. And no.
No, exactly. Well, it is so interesting with medicines because I know I get a lot of people saying I'm much more creative on this medicine. Well, usually that's a substance. I'm much more creative on this substance, and yet the medicine dulls my creativity. Do you hear a lot of things like that perhaps, I know the brain is an organ and therefore I can get a physiological symptom, I can get a psychological symptom, and they're all real symptoms.
Yeah, of course I hear that. There are some medications that actually do dull some of their senses and that kind of stuff. It's just, again, it's that collaboration, that follow up with your physician to find out what's working for you. I don't want to give you a medication if it's not helping you,
Right.
or if it's hurting you more than it's helping you. And that's what I tell my patients. It's like, let's work together in a collaborative way to figure out how to best help you.
All right, you two, then let's work together in a collaborative way. What is the role and the goal of medicines in the psychiatric field? What are you trying to do and achieve?
The main goal is to sort of completely resolve or have a remission of the episode or symptoms that you're treating. So if you're having a severe depressive episode, the goal is to treat someone with a combination of meds and everything else to get them to the point where they're no longer depressed.
So are we managing rather than curing typically?
Most of the time, yes. There are a few disorders in psychiatry that are sort of one and done. Lots of them are these recurrent illnesses. So it's treating the episode to remission and then managing and preventing future episodes.